Ask questions.
Get answers.
This is Experts on Call
On News Talk 580 CFRA.
Over the years, many of us have fought tooth and nail, literally, about going or not going to the dentist. Unless, of course, we had a cavity that is blindingly painful. This hour, it's into the dentist's chair with a process that you're probably going to look forward to. This hour, we're going to talk about the process of sedation dentistry, how it works, why it's preferred, and how you can take advantage of this great service and lots more. Dave Watts with you, and our guest this hour is the dentist and owner of Sedation Dental Group here in Ottawa, Dr. Dania Alkhani. Good afternoon, Dr. Alkhani. Can I call you Dania?
Yes, you may call me Dania. Good afternoon, Dave. Thanks for having me.
Oh, you're welcome. This is going to be an interesting hour for sure. Now, coming up, we're going to get into the latest approaches to dentistry, and we'll review all of the services of Sedation Dental Group here in Ottawa. So, Dania, I'm looking forward to this. Let's start off with a look at your professional history and what led you to focus on sedation dentistry.
Thanks, Dave. Pretty loaded question. It was a long journey, to be honest with you. I really do like medicine as a whole. I found, though, dentistry to be the perfect combination of my personality. I like dealing with people. I like solving puzzles. I like engineering. I like science, and I like art, really. So I found that this profession really encompasses all of my passions in one area. I found the sedation component to be really, really interesting because it actually helped me solve a lot of problems and puzzles that I couldn't solve without being able to administer sedation. So it really is kind of a journey, but it kind of led me to where I am today.
So let's talk about that. The Sedation Dental Group, you are the owner of the Sedation Dental Group. How did that come about?
Well, funny, I wasn't looking for it, and I wasn't looking to buy a practice. It kind of almost just fell in my lap, and I just fell in love with the idea. This was about over 5 years ago, I'd say. When I saw the practice, it was a little overwhelming, to be honest with you, but I really felt like it was where medicine meets dentistry. So as an owner, it's been quite challenging. It's a complexities because it's quite multifaceted. The sedation component does add a lot of liability, but it also is quite rewarding. There's this aspect of this practice that is basically offering a service to the community that's really lacking right now. And it really does help to transform lives. So as challenging as being an owner is, there's also this rewarding aspect of being an owner that really, really helps me get up every single morning and really enjoy what I do.
Oh, that's terrific. Now, the technology itself in the dental practice is certainly evolving on almost on a day-to-day basis, just about. Has that affected the methodology or the way you do things, or do they kind of work hand in hand? I guess they work hand in hand for the most part.
They definitely work hand in hand. I mean, technology is evolving really quickly. We know that. And we have to really do our research and we have to stay up to date on everything. We have some of the state-of-art technology that helps us provide and improve how we provide sedation and how we deliver dental care. So we have a new general anesthesia machine that's state of the art, that's hospital grade. We have, for example, like a glide scope, that's this protective equipment that's also one of the top notch, that's also used in the hospital, that's present in our clinic. We even have, for example, like a new technology called the CFRA machine, which helps us make crowns in-house, so we can actually deliver crowns or caps, as most people call them, the same day, so you don't have to go back and forth. So these are just some of the very few technologies that we've heavily invested in and that we've researched so that we can help improve our methodologies so that we can ensure both the sedation part and the dental part of the treatment are being delivered safely and effectively.
A lot of people feel anxious about going to the dentist. Certainly, I did. Everybody does at one time or another, I guess. Why is that, and how does Sedation Dental Group help a patient overcome that fear?
Yeah, this is a touchy topic because there's a lot of times the psychological aspect of it that we don't really understand. But I'm finding that a lot of the fear comes from past experiences, whether it's dental related or not. So we have many patients that had traumatic dental experiences when they were younger, and this resulted in them just delaying seeing a dentist or avoiding coming to the dentist altogether, sometimes like their entire lives. We've had some people that have served their country in the military and have come back with, unfortunately, post-traumatic stress disorder. And this resulted in them having reactions to just certain dental noises or just being in close proximity to people. Some people, they just don't freeze well. And so they're extremely afraid of pain or even the anticipation of pain. So they're just sitting in the chair really nervous about even the idea of feeling the pain. Some people have extreme gag reflexes and can't tolerate longer dental procedures. So these are just some of the issues or examples that contribute to either dental anxiety or the intolerance to dental procedures. We've gone to great lengths to train both the clinicians and the employees in how to deal with anxious patients. So we've laid out methodologies from the time the patient calls the office. So when the receptionist answers them, there's a certain way that we've trained them to do that. We have certain methodologies when the patient comes for their first consult with the dentist, when they do their pre-assessments with the anesthesiologist, if they do need deeper anesthesia. If, say, for example, they need more consults to help guide them along, we have treatment coordinators. We have methodologies that are set up for the actual day of treatment. The nurses are there just to cater for the patients. We even have post-operative procedures for follow-up and care. So they're really, really guided every single step of the way. And on top of all of that, we've had sessions with a psychologist to explain to us the mindset of patients who struggle with not just dental anxiety, but overall anxiety. So I've actually teamed up with a clinical psychologist, Dr. Irina Ivanova, and her team. And we created a tailored approach for these patients who suffer from dental anxiety. So whether the anxiety is just associated from entering the dental building or is from the actual treatment, I've worked with Dr. Ivanova closely to create tailored approaches for each patient's needs so that we can help guide them through the process and come out hopefully on the other side with very pleasing results for both the patients and the dentist.
Our guest this hour, Dr. Dania Alkhani, dentist and owner of Sedation Dental Group, and they're located at 441 McLaren Street right here in Ottawa. The phone number, 613-232-3725, and the website, sedationdentalgroup.ca. Right after the break, we'll look into more reasons why the Sedation Dental Group could be the solution that you need for your dental issues. Back in a moment on News Talk 580 CFRA.
Ask questions.
Get answers.
This is Experts on Call
On News Talk 580 CFRA.
Ask questions.
Get answers.
This is Experts on Call
On News Talk 580 CFRA.
Our conversation continues with Dr. Dania Alkhani, dentist and owner of Sedation Dental Group. And as we've mentioned, they're located at 441 McLaren Street right here in Ottawa. Great info online as well at sedationdentalgroup.ca. All right, Dania, let's take a look at what sets the Sedation Dental Group apart from other practices in the area. Let's talk about that.
Oh boy, where do we start? I guess we can say that we have a full-time medical specialist team in anesthesia. So we have a team that's led by a medical anesthesiologist, and he's gone to school for over 10 years just to learn how to safely put people to sleep. We have thorough safety and procedural protocols, so we can do hospital-grade anesthesia in our out-of-hospital settings. We cater to a large portion of the population that have many medical complexities, and we just have thorough protocols to deal with that. We also almost do it all when it comes to dentistry, whether it's just a cleaning that's needed, a filling, surgical extractions, or full mouth reconstruction. We can do it whether sedation is needed or not. So we have essentially become a one-stop shop for all your dental needs.
Now, I've heard the term TMJ. What is that?
TMJ stands for temporomandibular joint, and it's the jaw joint, which is one of the most complex joints of the body, and a lot of research is going into this joint. It's funny because many patients, they come in with jaw joint pain and they tell me, I have TMJ, and I kind of say, I certainly hope you do. What they actually mean is that they have temporomandibular disorder, or TMD, of the TMJ. So TMJ is the joint, TMD is the temporomandibular disorder of the joint.
Okay. Now, I guess that brings us to neuromuscular dentistry. Did I get that right?
Yes, neuromuscular dentistry.
Talk about that and maybe review again what it is and what it involves and how it helps patients with conditions like headaches, neck pain, and TMJ issues.
I really am excited to speak about this because it really is an area I truly enjoy, and it really is a life-changing experience for many patients. So neuromuscular dentistry is when we use equipment and technology to determine where the position of the head, neck, and the jaw should be that is most in harmony with the physiology of our body. So it's where the muscles of the head and neck are most comfortable. So we have to take into consideration both the nerves that are associated with the head and neck muscles, as well as the muscles themselves, and hence the term neuromuscular. So I can kind of elaborate on that if you'd like here, Dave.
Sure, please do.
So, okay, we first start off by doing a very thorough examination to determine whether there are signs or symptoms of muscle pain or malalignment outside of the mouth. And so we do a lot of palpation of the head and neck muscles. And then we determine whether there are signs and symptoms of pain inside the mouth, like, for example, wearing of your teeth, breaking of the teeth. And then we look at the alignment or malalignment of the head position relative to the rest of the body. So not all patients that we treat neuromuscularly are symptomatic or are in pain. Some have signs like wearing down of their teeth without having symptoms of pain. So the procedure starts off by us measuring how tense the muscles are with something called an electromyograph. And these are just electrodes that we put on the head and neck to measure their muscle activity. And then we place electrodes to help stimulate these head and neck muscles at a very low frequency so that we can fatigue the muscles and let the jaw drop where it's most comfortable, and it's called its physiologic rest position. We then capture the patient's bite at that comfortable rest position, and we formulate what we call an orthotic that the patient wears for a few weeks to determine if there is healing of the symptoms of pain if they are in pain. And if they're not in pain, we use that orthotic just to assess whether they are comfortable at that new biting position. After we determine that they are comfortable with this orthotic, we then move to treat all the upper and lower teeth, whether it's crowns that are needed on all their upper and lower teeth, whether it's implants, dentures, or a combination of all these three restorative options. And then we basically determine the functionality of the teeth and how they come together in relation to not just the jaws, but the head and the neck in their most comfortable physiologic position. So during the process, we are looking at improving not just functionality, but we also improve aesthetics as well.
Now, what about the long-term benefits of neuromuscular treatments?
Okay, so this 90% of pain is derived from muscle. So the main long-term benefits is that we are treating the source of the pathology and not just the surface problems, and not just the symptoms. For example, when we see a person that's really clenching or grinding, it could be because the patient is having breathing issues from sleep apnea, or it could be because of enlarged adenoids, or it could also be because their muscles are trying to get to that comfortable physiologic position, and they're grinding away teeth that are getting in the way of achieving that position. So we don't just put crowns on teeth because they're worn down or broken, because you can just break down the crowns that we put in there. We actually try to figure out how you got to the state that you presented in our office, and then we work backwards to find the source of the problem and target the source of the problem for long-term relief and functionality. Now, some people are very young and they've had trauma of their jaw joint, but their teeth don't really need fixing. So we fabricate the orthotic for long-term use to avoid touching the teeth and to prevent further wear. This just helps alleviate some of the symptoms. So realistically, this is usually a life-changing experience. Some people have searched and searched for ways to alleviate pain and nothing seems to work for them. And this has helped really relieve some of those pains that they've been tolerating their whole lives. And some people are not even aware that they have problems and just live with their problems their whole life. But once corrected through neuromuscular dentistry, they just feel so much better.
Oh. Now, how long, or I should say, how many treatments on average would a patient have to undertake to take advantage of neuromuscular treatments? I guess it really depends on what their issues are.
Yeah, so everybody has to come in for an exam. And then everybody has to come in for a record. So that might just be 1 or 2 appointments there. Then we basically, once we determine what their treatment plan is, then they have to come in for that, like I said, the stimulation, or we call it TENSing, trans electrical neural stimulation. So that's another appointment there. And then from there, we decide whether we're going to give them an orthotic for them to wear long term, or we then decide whether they're going to go with basically more permanent solutions like full crowns, bridges, implants, dentures, and whatnot. So it really does depend, but there is a minimum of about 4 appointments, whichever way you go.
Mm. I'll jump into something that affects many of us, I suspect, from time to time, gum disease and the implications for broader health impacts. Let's look into that.
So yeah, exactly. Many studies have been done linking gum disease to your overall health, and is correlated highly with other systemic diseases such as diabetes, heart disease, kidney disease. There's been many studies on this. So essentially, every new patient that joins our practice gets an overall complete exam of their head, neck, and mouth. And part of that assessment requires us to thoroughly examine the gum tissue and supporting tissues of the teeth. And then we have to determine the regular cleaning regimens that they should be put under. So usually it's every 3, 6, 9, or 12 months that a cleaning should be done, depending on what we find on that assessment. And this is really just preventative care. For some people, it's so far advanced that it becomes our main focus before we can even do dental treatment. So it's really, really critical because it does have overall implication on our overall, not just our oral health, but also our systemic health.
Now, patients certainly may be nervous or medically compromised and decide from that to avoid the dentist. But how do your sedation options make it easier for them to get the care that they need?
So as I mentioned previously, we do offer all levels of sedation. So whether it be mild, moderate conscious, deep, or even general anesthesia. And we do this for all types of dentistry. So whether it just be for cleaning, or it's for filling, or for full mouth reconstruction. After the initial consultation with the dentist, we mutually decide, the patient and the dentist, on what sedation level is best for whichever procedure the patient requires. So some patients say, hey, you know what? I can tolerate a cleaning. I'm okay with that. So we might do no sedation or very light sedation like laughing gas. But then they say, you know what, I cannot handle the drill in my mouth, or I cannot handle a needle, and I just need to be put to sleep for that. So then we might do deeper sedation or anesthesia for that. So it really does depend on what the patient needs. Sometimes they say, hey, I cannot tolerate anything, and we'll just do long treatment plans like cleaning, fillings, crowns, surgeries, etc., all in one appointment, usually under deeper sedation, just so that we can cater to the patient's needs and comfort.
Our guest this hour is Dr. Dania Alkhani. She's a dentist and owner of Sedation Dental Group here in Ottawa, and they're located at 441 McLaren Street downtown, and the telephone number is 613-232-3725. Dania, we're going to take a quick break. We'll be right back on Experts on Call on News Talk 580 CFRA.
Ask questions.
Get answers.
This is Experts on Call
On News Talk 580 CFRA.
Ask questions.
Get answers.
This is Experts on Call
On News Talk 580 CFRA.
If you're just joining us, good afternoon once again. Our guest this hour in conversation is Dr. Dania Alkhani, and she's the dentist and owner of Sedation Dental Group here in Ottawa, and their office is at 441 McLaren Street, and their telephone number is 613-232-3725. And just before we get into this, Dania, what is your web address? Folks might want to bookmark that.
sedationdentalgroup.ca. So all one word, www.sedationdentalgroup.ca.
All right. Now let's take a look at some of the wide range of services that Sedation Dental Group provides. I guess we could break it down into the different areas like cosmetic and restorative dentistry, as well as Invisalign. We talked about that during the break. Let's dig into some of your services.
Yeah, so we've talked about sedation, and that's just used to help supplement and ease dental treatment. However, we do offer all areas of dentistry. So we have restorative treatments such as fillings, crowns, or what most people know as caps and bridges. And then there's cosmetic dentistry, which is veneers or caps on all your teeth, or at least your front teeth that are showing when smiling. We have Invisalign. You can think of them as almost like clear braces or trays that you just constantly change out every 2 weeks or so to better align your bite, and that helps both in functionality and aesthetics. We also do new teeth in a day, where all your teeth are removed and then implants or posts are placed, and you walk away with dentures all in one day. We do surgeries, including wisdom teeth extractions, implant placements, and gum grafts. And we also do emergency dental treatments where we try to get you out of pain, usually with prescriptions or some sort of quick dental procedure, and then usually have to come back to get the actual full dental procedure done.
All right. I want to slide back to new teeth in a day. Dr. Alkhani, that sounds rather interesting. Let's talk about that and what patients can expect, what they need to do to prepare, perhaps, and the process itself. New teeth in a day.
So new teeth in a day is just kind of a term where when we termed essentially for patients that have teeth that are terminal and they cannot be saved, they can't be restored, and we want to give these patients the same day smile, essentially. This requires that all your teeth be removed, implants or posts are then placed in the jaw, and the dentures are then fastened to these implants. So the patient comes in with a broken set of teeth or missing teeth, and then the patient then walks out with a complete set of teeth all in the same day. And it's truly a transformative experience, as this is usually associated with patients who let their fears get the better of them, or who have just neglected themselves and put themselves secondary. So it's truly an emotional experience. It is one of the hardest dental procedures. Many patients come in thinking that they need it, but they don't. So we're very selective in who gets this procedure. However, when the patient actually really needs it, we do approach it very delicately. We don't take it lightly at all. There's a lot of coaching from our end, as many patients are very sensitive, not just to the dental procedure because it is a larger surgical procedure, but they're also very sensitive to their self-esteem. So we're very, very well aware of that, and we try to guide them along the way so that they can get the best results. It is, like I said, truly, truly transformative, and it's truly rewarding for not just the patient, but also the clinician to see them coming in with very little functionality, sometimes in pain, very low self-esteem, to almost being a whole new patient after that. And that usually happens just in one day.
What happens if there are specific gum issues or mouth issues with a patient who wants new teeth in a day, for example? How do you work around that, or what needs to be undertaken in order to get the patient's teeth as might be needed?
When a patient comes in that state, usually their teeth are not restorable. So that means all their teeth have to be removed. It also gives us a good indication on how they've been taking care of their teeth, and their gums. So we will not proceed until we are very, very thorough on what's expected after the procedure. All procedures that we do, especially advanced dental procedures, we always make sure that their post-operative care throughout their lives are going to be very, very well taken care of at home, so that whatever they get done is going to hopefully last. So usually people who need same teeth in a day usually have gum disease issues. Their teeth are broken down. Like I said, there's usually either neglect or something that goes on, or they just really didn't have the knowledge of how to take care of their mouth and their teeth. And so we first educate the patient. Sometimes we do a thorough cleaning just to kind of get their gums to heal a little bit. But because it's a really big surgical procedure, there will be a lot of, I should say, ache, like swelling, maybe aches that day, but it really subsides quite quickly. And realistically, after that, the patient has to do, their share of cleaning under the dentures once they receive the procedure.
Very interesting. Now, this is kind of a side question here. For folks in the past, and I'm going back many, maybe even decades, that have had issues with broken teeth, and then it's sort of been realized that a lot of them, or cracked teeth, could be the result of maybe pins that were installed in the tooth a long time ago to hold the amalgam and all that. And after decades, the tooth breaks down or it gets weaker or something. And could those contribute to cracked and broken teeth as well later in life?
Yeah, so there's a lot of discussions about that. Basically, pins that are placed in the past are good for retention, but they do cause strain on the teeth and they can cause cracking of the teeth over time. The silver fillings, they have mercury in them, so they expand and contract every time you eat or drink something hot or cold. So that puts pressure on the teeth with time. So depending on the amount of damage to the tooth can be restored, say with either fillings or crowns, or they might just not be restored, like you might not be able to restore them at all, and they just have to be removed. So there are some regular wear and tear over the years. There are some functional aspects that have been placed in the teeth, like pins, like you spoke about, or really large fillings that can contribute to all of that. But realistically, a lot of it is just how well do you take care of your teeth and how often do you visit the dentist? Because the sooner that you pick up on the problems, the better chance that you can probably save the tooth.
That makes so much sense as well. Now, for those that don't have any current dental issues, can they still register as a patient and be ready for future needs?
Absolutely. We actually see many regular patients that don't require sedation of any kind. Many people just live in the area or work in the area and they just need a dental home. So we are always open to new patients.
Okay. Now let's take a look at preventative care and certainly patient health. And this is something that's always a top issue. Preventative dentistry, of course, certainly key to avoiding future issues, but many people only visit the dentist when they have an emergency. Why is that? And how do you help change that mindset?
So many people avoid the dentist because they are too scared of coming into the dental office or because they neglect their oral health. However, as we spoke about previously, your oral health needs to take priority because it does contribute to your overall function and to your systemic health. So it's really highly recommended that you come in for an overall exam and regular hygiene appointments because maintaining good oral health is easier than having to catch up and reestablish good oral health, if that makes sense.
Yeah, it does. So basically the bottom line, it's like trying to get an annual checkup with your doctor, your family doctor, maybe even twice a year, coming to see the dentist for a cleaning, coming to see for a check of the health situation of your mouth and so on. Very important issues.
Very important. Sometimes we see lesions that just develop in the mouth from year to year. So it's not just about your teeth. Sometimes it's just the structures like on your tongue, your cheeks. So it's, like I said, bringing the mouth back to your overall health, that concept, I feel like needs to be really driven home just because I feel like people, for example, when their, body aches somewhere else, they'll go to the doctor right away, but with their mouth, they kind of seem to neglect it here and there, but it really does contribute to your overall health. So it's very important to get those regular checkups based on what we determine on our initial assessment.
That's true. And kind of going back to something that we touched on earlier, if your teeth need attention, perhaps you've got gum issues. Those are the kinds of things that can affect your overall health.
Exactly. So your teeth are supported by your surrounding structures, whether it's your gums and your bones, and all of them are made up of little cells that something can go wrong. And we basically have to, the earlier we pick up on these problems, the better chance that you're going to be able to have a good recovery or a full recovery.
Our guest this hour is Dr. Dania Alkhani, dentist, owner of Sedation Dental Group. The website, sedationdentalgroup.ca, and their office is located at 441 McLaren in Ottawa, McLaren Street, of course. The phone is 613-232-3725. Quick break. We'll be right back on News Talk 580 CFRA.
Ask questions.
Get answers.
This is Experts on Call.
On News Talk 580 CFRA.
Ask questions.
Get answers.
This is Experts on Call.
On News Talk 580 CFRA.
Dr. Dania Alkhani is a dentist and the owner of Sedation Dental Group here in Ottawa. She's our guest this hour. Before we recap some of your services, Dr. Alkhani, let's talk a little bit about the history of the group and how it came about, Sedation Dental Group. Let's get into that.
Yeah, so Sedation Dental Group is actually over 40 years old. It was first created by dental anesthesiologist Dr. Elwood Mitchell, and it was actually at a location a few blocks down the road from where it currently is. It garnered a lot of success. So a few years later, he moved the practice to the current location in downtown Ottawa on 441 McLaren Street, and it was sold to 3 other dental anesthesiologists at that time. I then bought out the practice a little over 5 years ago. The original model of this practice for a long time was you had one provider that was providing both the anesthesia and doing the dentistry. When I came on board, not being a dental anesthesiologist myself, I took a fresh look at things and noticed that there was too much liability on one clinician doing both the sedation and the dentistry. And so I switched the model to what we are doing now, where you have both a dentist and a medical anesthesiologist in one operatory room. So the medical anesthesiologist is providing the sedation and the dentist is doing the actual dental work or the surgery. This has worked out really well because I found the anesthesiologist can then focus on their area of specialty and really develop that and advance that and the methodologies and the protocols with that. And the dentist can then focus on their areas of expertise and really develop their areas of interest. So many of the patients that have been here for the whole 40 years, and so we've been able to maintain that continuity of success that has been in Ottawa for over 4 decades at this point.
Wow, there's a long history there. It's terrific. Now, for those just joining our conversation, that was very interesting info. Why should listeners consider Sedation Dental Group as their primary dental care provider?
Essentially, we do it all, like I said. So we're essentially a one-stop shop. The sedation component helps facilitate the dentistry. And basically, then we do all of the dentistry. So we do almost all types of dentistry with or without sedation. However, like I said, the clinic has a long-standing history of specializing in doing dentistry under sedation. We have created advanced methodologies and we've obtained advanced equipment to treat some of the most complex dental cases for patients, even with advanced medical complexities. So we are that one-stop shop.
And this is a great place to make an appointment for those that perhaps suffer from anxiety or stress going to the dentist. You know, it's not a total 100% relief, but I'm going to say it's a 99.8% relief.
So basically, yeah. So essentially, patients that come to us usually have had a hard time coming in. And we do try to, like I said, whether it's the psychological aspect that we have to target first, or whether it's the actual procedure, we have, or whether it's just coaching, we have steps and protocols and people every step of the way to try to get you through. So I don't know about 99.8, but maybe 99.5.
Oh, terrific. Now, how does good oral health impact overall well-being? We kind of touched on that a while ago at a couple of spots, actually, over the hour. But why is it so important to treat issues early before they escalate into something more serious?
So I feel that we really need to emphasize that prevention and maintenance is far easier than trying to catch up on your oral health. And what I mean by that is that it's easier to keep your teeth and your oral health in check if you are consistently getting looked after. And if there's a dental issue that arises, it's easier to treat it earlier on. And it's actually even more cost effective than letting it escalate. And then it becomes more difficult and usually more costly. So patients usually who attend their regular dental appointments usually actually end up spending less over their lifetime than patients who neglect it or put it off and then have to catch up on obtaining good oral health.
All right. Tell me, how can listeners get in touch with Sedation Dental Group, even if they don't need dental work right away, but they want to make an appointment, they want to get listed as a patient? What are some of the things that they should do right at the beginning, right off the top?
Honestly, just give us a call if you're comfortable with that. 613-232-3725. Realistically, our receptionists are really, really friendly. They'll take care of you from the start. If you feel like, you know what, you just have a few questions, then just email us. You can email us at smile@sedationdentalgroup.ca. So that's all one word, smile@sedationdentalgroup.ca. Or you can just check us out online. So www.sedationdentalgroup.ca, all one word. Honestly, we do it all. Like I said, you might not need dental treatment, but you might want to learn more about our advanced sedation techniques. We offer it for patients with anxiety, people with cognitive disorders, children, people with medical complexities. We really, really try to take the fears and concerns of the patients themselves and also their families that are involved with the patients. So we like to inform them of how we will look after the patient, and we like to inform the families on how we look after their loved ones or their child. So it's not just the patient that sometimes is in question, it's the families too. And they're always so appreciative because our efforts are to inform the patients and their loved ones about what we do, how we're going to take care of them. And the patients are always so appreciative of that.
I guess so. Now, do you accept referrals?
We do definitely accept referrals. We actually have many referring offices that, have been sending us patients of every kind. Sometimes it's patients that, have cognitive disorders. So they have dementia or Alzheimer's or Down syndrome. So they're not very cooperative in the chair. We have sometimes kids that just, also need some sedation or general anesthesia, and they just need to be put to sleep, and that's not offered readily in Ottawa. And then we have patients that just have more, there's a psychological component, and they just need people that really understand them and can guide them and have a facility that they feel safe in. And so, and understand that part of their fear. And so we do get referrals from a lot of different dental offices, and we do encourage referrals as well.
Terrific. Dr. Dania Alkhani, we're out of time. You're a dentist, of course, dentist, owner of Sedation Dental Group. Thanks again, Dania. Great conversation this hour, very informative.
Thank you so much for having me, Dave. I really appreciate it.
And don't forget that telephone number to get in touch with Sedation Dental Group is 613-232-3725. Go online for more info, as always, at sedationdentalgroup.ca. Dave Watts here. Have a great afternoon. News is next on News Talk 580 CFRA.
The preceding program has been a paid presentation on News Talk 580 CFRA.